It's Kristen or VSG Hard on My Sleeve, and I am coming to you for a post-op 3-month doctor's visit sort of recap. Um, I'll give you a teaser now. At the end of the video, am posting before and after pictures. So from May 2013, before surgery, until now, August 2013, 3 months after surgery. So if you make it through the video or fast forward, you will see my before and after photos as a work in progress. So let me jump right in to let you know. I wanted to talk about things I learned and discussed with my doctor. Sorry, let me pull up my notes. So this was my 3-month post-op visit. I saw my nutritionist and my surgeon. It always makes me feel so good to see them. They're so positive, and it's just a good reminder of where you came from and all the work you did to get to this point. And, they were really complimentary. So let me just start by saying, first of all, I broke the stall because I weighed in on their scale at 177 something. And if you've seen my recent videos, I've been stalled at 178 or just under. So I've lost like a pound in the last day, which is awesome. Take that scale. But anyway, so first thing they told me is that I'm actually 60% of the way to goal at 3 months out, which is pretty surprising, and they're pretty surprised too. They said I'm following the track. If you look at I guess it would look kind of like this. If you look at the weight loss graph, a sleeve person might drop their weight at this curve, okay, whereas a gastric bypass person might drop weight on sort of this lower curve. So they said I'm actually closer to this lower curve of a gastric bypass patient, most of which they are crediting to my weight, and my age, and also working out, and the fact that I didn't have a bunch of health problems to begin with. So if you go back to my earlier videos, you'll see that gastric sleeve patients lose a lower percentage of their body fat than gastric bypass patients do, but they expect that if I continue at this rate, I'm probably going to lose the percentage of what a gastric bypass patient loses, and at that rate. So that was good to hear, because that's what I wanted anyway. I believe gastric bypass is like 90% of your excess weight, whereas sleeve is 70%. So along with the percentage of excess weight, one thing that we discussed was my goal weight, which she had listed as 148, I believe. And I said, no, that's not going to cut it for me. I want to be, I don't care what the number is, but I want to be in the healthy BMI range, which I believe is about 140. Well, what she told me is the 10% of excess weight that a gastric bypass patient doesn't usually lose is skin. Apparently, if you've been overweight or obese, your body has to grow more skin to contain the fat, the extra size. And so while your skin, the elastic, recovers, it's still extra skin. So the way she described it to me is like if you think of a fruit peel, it might, because of the elasticity, bounce back, but it's going to be thicker skin like a banana rather than an apple. So you're still going to have that excess weight, unless, of course, you have plastic surgery to remove it. So she said, let's say I get down to 140 pounds. 10% of 140 pounds is 14 pounds. So even though I weigh 140, my body is physically going to look like I weigh 126, if that makes sense. I thought that was interesting, something I had never thought about before. Still doesn't change the fact that I want to be, I think 140 is what would put me in the healthy BMI range. So if I'm 140, minus that 14 pounds, I guess I'm going to look like 126, but I'll take it anyway. So just an interesting interesting fact for you there. The thing I asked about was my bougie size. And my surgeon told me he uses a standard size 36 French bougie, which seems to be pretty middle of the row for sizes. He said to imagine your stomach as the diameter is about the size of a nickel, or a very small banana in total. So it's, I mean, obviously I know that I had surgery and it was removed, but it's still strange to hear it compared when you actually visualize that. It's kind of crazy. But so I had never known what size bougie was used, and now I know, 36. What else did I want to mention? Oh, people had asked what formula my nutritionist used to determine or predict how much weight she thinks a patient is going to lose. So with me, the first month, gastric bypass patients typically lose 10% of their body weight. And she, I had done that. So she said those patients also typically lose another 10% over the next 2 months. So by month 3, you're down 20% of your original body weight. So because I was a sleeve patient, she guessed that I would lose 38 pounds because a gastric bypass patient would have lost about 42. So she took that 20%, subtracted some weight, and there wasn't really a formula, unfortunately. But she's doing it based on years' experience and average statistics. So today I weighed in and I was down 48 pounds. So I beat her prediction by 10 pounds. So I was like, yes, as long as I'm exceeding their expectations, then I'm doing really well. Okay, what else? So my next appointment is my 6-month appointment. At that appointment, they'll go over the results of my vitamin levels and hormone levels, which I have to have done, the lab work done like 2 weeks before that appointment. So that'll be in November. And then finally, I talked to them because I've been getting a little bit of orthostatic hypotension. So if you don't know what that is, it's also called postural hypotension, or in layman's terms, it's when you stand up and you get sort of a dizzy feeling or lightheaded feeling. It doesn't happen to me all the time, but occasionally I get it if I get up too quickly. And so I know from med school it's often a result of dehydration or, too low of blood pressure. So I talked to them about it just to see what I should do. They said increase my sodium, which sounds kind of crazy because, we don't want to be retaining water. But they said, my doctor said, he's not saying go eat a bag of potato chips. He's saying, like, have a pickle every other day. Or he actually mentioned, so this is a shout out to Leah. He mentioned the Special K crackers, sea salt kind of crackers that she mentioned in her recent video of food she eats. So he said eat some of those, every other day. Or he also said it can be due to a lack of potassium. So they recommended trying to drink one of the small cans of V8 tomato juice or V8 Fusion, the light variety, so you're not getting too many calories, but to try to increase my potassium and increase my sodium. So I'm going to try that and see if it works, and we'll go from there. But just some interesting tidbits that came out of my appointment. I think that is it. Yeah, that is it for now. So I will go ahead and stick the before and after photos in, and thanks for watching. I will see you guys. Hope you all have a great weekend.